The signs can be obvious: a little gray hair, a lack of energy, loss of appetite. Older dogs can make wonderful companions, but they require special care. On this episode of the Paw Report, we're joined by veterinarian Dr. Jean Pavlovsky to discuss how we can make the senior years golden for our aging pets. Stay with us.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Thanks for joining us for this episode of the Paw Report. I'm your host, Kelly Goodwin, and today we're talking about the subject of pets aging gracefully. And to speak more on that topic, we're joined by first-time guest, Dr. Jean Pavlovsky. Thank you so much for joining us today. We appreciate you making the trip to Charleston today. And as always, as a first-time guest, we always like to kind of put you on the spot and give our viewers a glimpse into your resume.
Yeah, thanks for having me, Kelly. I'm a practicing veterinarian. I am an instructor at the University of Illinois College of Veterinary Medicine. I am a primary care practitioner, and I participate in the clinical training of students, fourth-year veterinary students. I'm a small animal veterinarian, so dogs and cats are my specialty.
Well, as I mentioned, we're talking about pets aging gracefully, so it's probably fitting that my first question is, well, is my pet old? What actually determines whether my dog is, of senior status?
Mm-hmm.
Is it age? Is it years? Is it breed?
Kelly, it's all of those things. It's somewhat of a complicated question. There's a formula out there that some people use to determine how old a dog might be in human years, and it's roughly 7 human years per year of dog years. But it's somewhat of an inaccurate formula. As you had said, breed and size of the dog determines how quickly they age. And in fact, dogs develop more quickly, they age more quickly in the first couple of years of life. So really the formula is a little bit more complicated. If you think of the first couple of years of life in a dog, they really are roughly to about 10 years of a person's life, and then it levels out to about 4. So it becomes a little bit more difficult to calculate. However, bigger dogs get older more quickly. They age more rapidly. They do not have as long of a lifespan, whereas little dogs like Chihuahuas and Yorkshire Terriers, it takes them longer to age and they have a longer lifespan.
Dogs don't always show clear signs of, when they're aging, if they've got problems. I mean, what are some things that pet owners can kind of keep an eye out for? What signs of disease could be happening within your pet?
Yeah, it can be difficult. Dogs are relatively stoic animals. They often don't show signs of illness in ways that people interpret them to be signs of illness. Sometimes we see a dog that's aging and becoming slower, and we may assume that this is just because of aging and natural weakness that comes with age, but it may in fact be due to chronic pain, or it may be due to other problems. And so there are sometimes relatively vague signs of problems that may be difficult to interpret, and sometimes they're more clear. Sometimes it's things like limping or urinating in the house, or the appetite is no longer there. So sometimes it's pretty clear and sometimes it's difficult, and that's where I think it's important to engage the help of your veterinarian to help to decipher those signs.
Do you ever notice if signs of aggression could be kind of mixed in with those signs as well? You know, if maybe you're petting and they grimace, or if different people come into the home that they are a little maybe annoyed or scared. Is that something that can be an issue as well?
Definitely. Aggression is actually relatively normal because it is a natural response to a perceived threat. However, it's not a normal behavior in the context of a normal, healthy pet. And so when a previously non-aggressive dog develops signs of aggression, maybe it's related to handling or proximity or being close to their food or toys, it always should serve as a sign of potential problems, especially in a dog that's never developed those types of signs. So it can definitely be a sign of pain, sign of emotional distress, signs of other illness, and something to definitely bring up to your veterinarian.
There are a laundry list of, unfortunately, different issues, diseases that dogs can experience in their senior years. Share with us some of those, and maybe highlight some of the bigger ones as well.
The list of diseases may be breed dependent. There are some breeds that are more likely to develop age-related diseases that are maybe different from those that are of different breeds. For example, smaller dogs can develop heart disease. Diabetes is fairly common in dogs of all breeds and sizes. Obesity, being overweight, can be a serious problem that can lead to other issues as well. Vision, hearing is fairly, vision and hearing problems are fairly common to dogs of all breeds. Kidney disease is relatively common, and that affects dogs of all breeds and is a little bit more common as they age. So there is quite a bit of a laundry list. When we are presented with a dog who has signs of illness, it helps us to know what breed they are, what age they are, because that in itself carries a list of possibility that may be different for other breeds.
And you said, you just talked about that. I think it's important too, as pet owners, to maybe keep a diary. If they start to see some things, maybe just jot it down, so when they eventually, do make it to their vet, then they've got paperwork that says, okay, this is what I've noticed, this is how it's progressed. Do you see that, or do you encourage that with pet owners?
We do see that occasionally, and sometimes pet owners come in with a diary and they almost feel guilty having written down all of the things that they've seen because it's sometimes so much. But to us, it's actually helpful than having to rely on memory and ask questions that pet owners may not remember answers to. The other thing to remember is that for people who live with their pets day in and day out, subtle changes may go unnoticed. For us, if we haven't seen this pet for a couple of years or a year, and all of a sudden we're presented with a problem that's new to us, it's a more jarring notification of a problem. Whereas to a pet owner, this may have been developing in such a slow, insidious way, they may not necessarily see it as a problem.
Another problem is movement. Can you talk about that, and maybe some things that you've witnessed or pet owners may notice at home with mobility?
Yeah, problems with movement and mobility are common in older dogs, and just like with people, muscles get weaker, joints get achy, and that's without developing conditions like osteoarthritis when there's inflammation and degradation of joint surfaces. Obesity can definitely make things worse because heavier pets can find it difficult to get around. The less they get around, the less muscle they use, the more muscle atrophies and goes away, supporting them less and less. And so it becomes a vicious cycle. The less they exercise, because they may be painful, the more muscle they lose, the less they exercise. And so mobility problems are common. There are some things that pet owners can do, and a lot of it centers around regular exercise and early detection of signs that may be consistent with pain, so that pain can be relieved in order for the exercise to be more comfortable and more effective.
As a pet owner myself, I've had Labrador retrievers over the years, and a special lab in my life was Lucy, and she suffered from terrible incontinence, and it was a struggle for that in our family that we had for several years. And after speaking to other pet owners, that's something that is pretty common. And my poor Lucy, I could be out of the room for 5 minutes or 5 hours. It didn't matter. There was a urinating issue, and it's hard for a pet owner.
It is.
Do you see a lot of that, or what advice can you give to those of us that have struggled with that?
It's a fairly common problem, and it can really make a dent in the human-animal bond when you're having to clean up urine. And no matter how much you love your dog, it can become very frustrating. But I think we have to define incontinence and realize that there are many potential causes. Incontinence is defined as inability to hold urine or feces, and in most cases it's urination that becomes the problem. And there are several causes. Incontinence in female dogs can often be the result of inability to maintain tone in the bladder sphincter, allowing the urine to simply leak out when they are relaxed. But incontinence can also happen with diseases like diabetes and kidney disease and neurologic disorders that affect the bladder and the urinary system. And so for us as veterinarians, it becomes important to differentiate the potential causes of incontinence, because if it's kidney disease, that's a completely different situation than bladder sphincter incontinence that may just be treated with medication to strengthen the bladder. Having an underlying disease carries with itself different implications. And so it's important for pet owners, I think, to bring their concerns up to their veterinarian so we can investigate the cause of the incontinence and come up with an effective and safe treatment for the underlying condition that causes it.
I mentioned aggression, and you can see some of that, but what are some other behavioral changes that you can see in your pet? And the other thing I think, and you had talked about, is when you're with that pet, all the time, sometimes the changes are subtle and you just don't see them. So what can you provide to us to say, if you see this, take note?
Yeah, there could be lots of different behavioral changes, from reduced mobility and just being disinterested in going for walks and, being less interactive, to being withdrawn, being confused, losing the ability to differentiate day and night. Some dogs become more active at night or restless at night and less active during the day. They may lose their house training ability, becoming visibly incontinent, or owners might perceive that as being incontinent. Some dogs stop recognizing us or don't hear as well. And so all of that manifests in different ways, but we essentially lose the dog that we once had, and she or he becomes this different creature, and we might perceive that as a poor quality of life, even if they're physically able to get around, but they're just not with us mentally. Some of this comes from age-related loss of brain function, similar to senility in humans. It's hard to prevent. I think early detection and taking some preventative measures can help slow the process down. But just like with age in general, there's nothing we can do to stop aging, and so there's nothing we can do to really stop progression of brain aging as well. Definitely environmental and cognitive enrichment play a role. Various types of brain games can help, using puzzle feeders that force the animal to use their puzzle solving or problem solving abilities to get food. Playing simple games like hide and seek, where two people on opposite ends of the house might call the dog and let them find them and provide them a treat for finding them, and then change locations. So things like this could be fun and stimulating for dogs, and get them moving around, get them to use their brain, get them to interact with us, and hopefully slow down that aging process a little bit.
What about diet and nutrition? Is that something that should be altered, changed as our pets get to that senior status?
Yeah, I'm glad you mentioned diet, Kelly. It's recent development in dog nutrition is partly responsible for dogs living longer. Our dogs are with us for a longer period of time because they eat now higher quality diets that are balanced and complete. There are some things that one can do to ensure good quality nutrition is to talk to the veterinarians, because it's a lot of times an individual decision. What one older dog might need as a complete diet may be different from another. There are some conditions, some breeds, some ages that require different nutrition. Generally speaking, a senior dog, and we already talked about how to define that, that's difficult to do. And I'm going to go back to that question in just a moment and tell you that, generally speaking, larger breed dogs like Great Danes or German Shepherds might be considered senior at around 6 or 7 or 8 years of age, and smaller ones maybe at 11 or 10. So there are some diets out there that are marketed as senior diets. One might choose to feed a diet like that. They're not necessarily always different from adult maintenance diets. So I wouldn't expect a diet like that to be a game changer for an animal of that age. Most older animals have reduced energy requirements and they don't need as much food. It's really important to keep them from becoming overweight and from overfeeding them, because it's easier to do. They might eat the same amount but not need as many calories, and therefore they might gain weight. So when an older dog becomes overweight and they have weaker muscles, it makes it difficult for them to get around. So that's an important nutritional consideration for aging pets.
How important is sleep? And I guess I could maybe load this question a little bit more. Your dog's sleeping a lot, or maybe your dog's not sleeping enough, and you notice that change too. And can they suffer the same problems as humans, as far as they don't get enough sleep that may prompt some dementia issues?
Mm-hmm. Yeah, and I think we hear a lot about the importance of sleep in people. Certainly it's important to get a good night's rest so that you're recharged for the following day. I think the bigger question for a dog who doesn't sleep well is why. Is it pain that's keeping them from sleeping comfortably? Is it some cognitive dysfunction and they're confusing night and day? So one must ask themselves why this dog isn't sleeping well. Why are they up at night pacing around and not settling? And maybe they're panting by your bed in your face all the time, or asking to go outside. So once that question is answered, if we can get as much information as we possibly can about that, then perhaps we can fix that and make them sleep a little bit better. And sometimes it's just finding a comfortable bed. Sometimes it's just relieving their pain if they have arthritis. Mm-hmm. But the more they sleep during the appropriate time of day, the more active they are during the other appropriate time of day, and they can interact and be active.
What about joint supplements? Kind of backtracking a little bit to nutrition. Is that something pet owners should consider, without getting into specifics about kinds or different brands, but
Sure.
Is that something that you support?
Most oral joint supplements don't have consistent evidence behind them in terms of being effective for all dogs all the time. There's lots of joint supplements on the market. There's lots of active ingredients, and they're all very different. Most of them aim at slowing down the progression of joint cartilage loss and improving health of joint fluid. The general consensus is that most joint supplements are probably not harmful, but it's really difficult to tell whether or not they're going to be helpful for this particular animal. I generally routinely don't recommend starting with joint supplements unless we have a specific diagnosis of osteoarthritis, for example, and use joint supplements in part of a multimodal approach. It's not likely that for most dogs a joint supplement of some kind will be significantly helpful, but it's also important to obtain a diagnosis. There's a lot of pet owners who see their dog become less mobile or begin to limp, and the natural assumption might be that they've developed osteoarthritis, which is degenerative joint disease that's age-related. But if it's not osteoarthritis, those joint supplements may not be helpful at all if it's some other different condition. So I think that before considering long-term supplementation, I would talk to their veterinarians to make sure that this is a path that's recommended. They may be spending money on a supplement that may not be helpful, so I think I would at least get their vet's input on whether or not that's the path to follow.
Proper hygiene, is that something that's important? Well, it's important for any age pet, but any special considerations for senior pets? Dentistry, having proper dental hygiene can be of the utmost importance.
Yeah, and I think those are, dental hygiene is a bit of a separate topic, and that's something that should begin way before they become senior pets. This is the conversation we hold with pet owners when they bring their kittens and puppies into us, Importance of regular at-home dental care can't be overstated. It's also one of the most difficult things to do. Unless you accustom and train your dog or cat to accept regular dental care, which amounts to toothbrushing essentially is the most effective way to prevent dental disease. Unless you get them accustomed to it early on, they may resist it later on in life, especially when they start having sore gums and it becomes painful to manipulate their mouths. Mm-hmm. So it's really important to start when they're really little and get them to develop a positive association with toothbrushing. And then it's going to be a lot easier. And then you're preventing dental disease, and that's one of the most important and one of the most common problems in older pets. Tooth loss, pain, gum inflammation. Hygiene in general, I think it's important too, especially for those that don't move around well, especially for those that might have longer hair. Having them regularly groomed, making sure that they lay on soft surfaces and don't have matting on their elbows, which they might use to push up off the ground. So just having general observation and brushing them every day and feeling their body every day to make sure there's no mats and sores and things like that is really important. That's just part of normal daily interaction if they allow it.
As far as veterinary care, should you take your senior pet a little more often just because of all the things we've talked about today?
Yeah, most of the time when dogs become seniors, we recommend having them physically evaluated every 6 months rather than every year. And that's because things can develop relatively quickly when they're older, and some of the signs of illness can be vague. When we detect problems before they become bigger problems, we can sort of reroute the course of disease in a lot of cases. We also recommend routine blood testing and urine testing in dogs that become older, because we can detect signs of problems earlier before they become symptomatic, before they develop visible medical issues, before they start urinating in the house or drinking too much water or something like that. We can detect that early kidney disease and help them slow the process down. And so when we do that every 6 months versus every year, we have the chance to intervene sooner if we detect a problem. Mm-hmm. Veterinary visits isn't just about a physical examination. We get to sit down with the pet owner, we get to talk about how they're doing at home. A lot of information we get about the pet that helps us to get a diagnosis is what pet owners tell us about how the pet is doing at home. And unless we do that, it becomes very difficult to decide what's next.
And probably another conversation you have with pet owners is the living environment. Just as we puppy-proof our homes, mm-hmm. when we get that little one, we have to kind of do the same as our pets age. Maybe they shouldn't be going up and down steps, mm-hmm. or maybe they're now more prone to get into cabinet space or mm-hmm. hop up on beds when they shouldn't. Is that a conversation that you have with pet owners as well?
Yeah, sometimes there are some breeds that could benefit from easier access to higher surfaces. For example, if you take little dachshunds who are relatively low to the ground, a lot of them tend to be overweight and they are known to have back problems. And so a lot of times if they are still willing to jump up on the bed and do so without help of stairs or ramps or something like that, they might hurt their backs. And so providing them with a different surface and a sort of a graduated access to those beds can be helpful. A lot of us have hardwood floors and other slippery surfaces. For dogs with arthritis, especially bigger dogs, it might be difficult to get around. So sometimes we recommend putting out runners or carpets or rugs or something like that makes it easier for pets to get around. Slippery stairs, that's another potential danger and hazard. Yeah, and so getting up and down the stairs can be difficult for those that have pain. And once a dog has fallen down the stairs, not only can they injure themselves, they become scared to navigate those stairs again. Some dogs lose their vision, and if they're given access to stairs at night, they might fall, not being able to see. So I think finding out those specific environmental differences in that particular pet's household becomes important, because we incorporate them into our recommendations. And it may be just as simple as non-slip booties that this dog wears, for example.
Mm-hmm. Something else that's important as our dogs get into their golden years is quality time with them. Mm-hmm. It's important as pet owners to have that bonding and to have those moments still with their pets, quality time. Mm-hmm. and praise, as you mentioned earlier in our conversation. And I'm sure you talk about that with pet owners as well.
Yeah, praise is important, and there are, we have to realize that just like for people, for dogs, there are different motivators. Dogs learn by association, and so if a dog learns to associate something positive with a different behavior, they're going to repeat that behavior. And so that is a lifelong process. I think that if we start with positive interactions with our dogs from the very beginning, they're going to learn that being with us and performing those behaviors that we find desirable is rewarded. Food is a great motivator for most dogs, and so we use treats and we use other things to get them to do what we want them to do, and I think that should continue into their older years. It's not just potty training and puppy that we're using treats for. Eventually they understand what they need to do, but we still need to reward positive behaviors with praise and attention and petting and food, because it is a positive and very good motivator for dogs. So we often recommend to continue that into adulthood, and if we see something that we want our dogs doing, we reward that with something yummy.
Well, what a positive way to end our interview today. Dr. Jean Pavlovsky from the University of Illinois, thank you for joining the Paw Report, first timer, and we always invite first timers back if they hit it out of the park, and you sure did. So thank you for joining us and providing some wonderful information to pet owners out there.
Thanks for having me, Kelly.
Yes, and thank you, our viewers of the Paw Report, for joining us for this episode. Until then, we'll see you next time.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.